Muscle mass peaks at around the age of 30, and after that it diminishes by about 8% every decade. And after the age of 60, that loss accelerates. And the loss of muscle mass and loss of muscle strength is called sarcopenia, and it's associated with physical impairment and disabilities. Estimates from national health data suggest that about 35% of older adults have moderate sarcopenia and 10% have severe sarcopenia. Now, the good news, though, is that performing resistance training exercises can improve muscle mass as well as physical function. In this video, I'll review how muscle mass affects physical function and how exercise can improve both muscle mass as well as physical function. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. I specialize in sports medicine and arthroscopic surgery. Because many terms sound similar, I'm going to define a few of them. So muscle mass is the volume of muscle. You can think of like a bodybuilder with large muscles. Muscle strength really speaks more to the quality of the muscle and how much strength it can produce. And as I stated before, sarcopenia refers to both muscle loss and muscle weakness. Let's jump right into what the study showed. And there's a meta-analysis of over 100,000 older people, and they found that both muscle mass and muscle strength are independent risk factors for someone developing a disability or becoming dependent on someone else to help them perform basic activities of daily living, such as dressing. And what they found was those people who had diminished muscle mass had a threefold increased risk of developing this disability versus someone that maintained normal muscle mass at an older age. There are different ways to calculate how much muscle mass someone has and how much they've lost. And many studies will break groups into different categories, such as low muscle loss, moderate, and high amounts of loss. And so there is a study that looked at about 4,500 older adults over the age of 60, both men and women, and they associated the different degree of muscle loss with how much functional limitation or disability they had. They found that the prevalence of a physical disability in women decreased from about 25% in people who had the most muscle loss, down to about 14% had disability in those who had about a moderate amount of muscle loss, and 11% disability in those who had very little muscle loss. Now, in men, they found very similar findings. Here they found a prevalence of 15% of the men had a disability if they had the most muscle loss. About 8% had disability if they had a moderate amount of loss, and only 3% had a disability if they had the least amount of muscle loss. And this study demonstrates very nicely lots of muscle loss leads to more disability. Less muscle loss helps people maintain their function. We were just talking about a more severe physical disability. Now let's move on to a functional limitation. The likelihood of having difficulty or inability to walk, let's say a quarter of a mile, was 3 times greater in the group that had the least muscle mass compared to the group that had the highest muscle mass. And there are other studies that show that these statistics are even worse, that it could be 6 times greater in the group that had the least muscle mass. How much muscle mass does someone need to lose before they start developing some sort of functional limitation or disability? And so here there was a study, again, 4,500 people over the age of 60, and they found that if someone lost 30% or more of their muscle mass compared to someone who is younger, that's when they would start seeing a problem. And what this indicates that there is some reserve in a human being that a very little loss of muscle mass may not show up as a problem, but once they start losing a lot of muscle mass, then we're going to start seeing issues. What is the role of exercise? Well, as we would expect, doing more resistance training increases muscle mass. And studies show that older people who are physically active or very physically active are 6 times less likely to develop sarcopenia compared to people who are sedentary. A meta-analysis found that performing strength training 60 minutes twice a week over the course of 3 months could actually increase muscle mass. And similarly, another study of older people, men between the ages of 60 and 72, if they were involved in a resistance training program over the course of 3 months, they were able to increase the mass of their quadriceps muscles by almost 10%. In addition to improving muscle mass, exercise can also improve physical function, and studies show that problems with physical limitations such as difficulty walking a certain distance can be improved with exercise, as well as physical disability, problems getting dressed or doing things like that at home can also be improved by performing resistance exercise. With regard to the specifics of the exercise resistant program, studies have looked at this too, and there's meta-analyses and other studies that have looked at the specifics. Performing higher intensity strength training does better than low intensity, and performing exercise training at least 2 to 3 times a week are important to maximize the gains. Let's wrap up this video and go over a few key points. Number 1, diminishing muscle mass is an important risk factor for developing a physical limitation or disability. Number 2, resistance training improves muscle mass and functional ability. Number 3, resistant training programs should be done at a higher intensity 2 to 3 times a week in order to gain the maximum benefits. And number 4, the next time you're in the gym or at home and you're flexing in front of the mirror, don't be embarrassed if someone catches you. You can always let them know you're just checking to make sure you have enough muscle mass to maintain your health. Thank you for watching this video. If you found it helpful, please click the like button below and subscribe. Thank you for watching my video. I look forward to seeing you in my next video or in my office.